are you?
Hi.
Oh, you've multiplied.
Yes, I did.
She came to take us back to Oklahoma.
Ah, got it. Okay, so I understand you're getting out of rehab tomorrow?
Oh, today. She
Okay.
was this morning.
Okay,
Yeah.
All right, well then there you go. Congratulations. How are you doing?
Good.
Okay.
Good.
All right, that didn't sound the most convincing, but yeah. Take me through the last week or two as far as just how you felt, everything.
Well, I still have a headache, but not the brain attacks.
Okay, yeah.
And then dizziness, of
Wow.
course, and shortness of breath
Okay.
that comes with the pain,
Okay.
and what else? The blurred vision does too.
Okay.
It's all related to the pain.
Bouts of confusion,
Okay.
but really small bouts, like,
Okay.
and it won't last for very long, like maybe 5 minutes.
Okay.
And then she'll come back full circle.
Okay.
But
The confusion is what's concerning us,
Okay.
more so than
to
anything else,
be honest.
Okay. Yeah.
because she'll be fine, and then all of a sudden the conversation will go, and she's not fine. She's
Okay.
saying weird things and like out of context, not quite understanding what we're saying to her, and that sort of thing. But it really lasts short term.
Okay.
It's also the hearing comes with the pain, the loss of hearing.
Okay.
But this isn't hearing. This is
Yeah.
saying things like, well, where is the ICU nurse? Why can't I see her? Well, because you're not in ICU anymore, Mom. And we're in the car at this point.
Okay.
you
Yeah.
know?
Yeah.
Or,
But she is having a hard time hearing, just so you know.
Yeah. Okay.
But it comes with the pain.
Yeah, and she does have a hard time holding her breath when she's in pain. So we're
Okay,
working
yeah.
on that.
Okay.
We
Yeah.
gotta work on that.
I'm
But
exhausted.
she gets worn out
Yeah.
really fast.
and so another reason why she has the sunglasses and the earplugs is
Mhm.
because she can't handle the bright light or
Yeah.
the sounds.
Okay.
But we think that'll go away.
Yes. Yeah. I think a lot of the things you're describing are very normal after all of this.
Oh, good.
Oh yeah, absolutely. So most people kind of, even if again you came to the hospital doing well neurologically, things people commonly deal with. So headaches for sure, without a doubt, some degree of headaches. Those will get better over time, but again, it's sort of how much of that is explosive headaches and terrible versus low grade kind of things like that. Intermittent confusion, kind of short-term memory loss, not surprising, both with the hemorrhage, both with the 10 days in the ICU, not getting normal sleep and delirium that comes with that, absolutely. Like you're saying, sort of bright lights, kind of feeling overwhelmed,
Yes.
fatigue, all of that is very, very, very common after all of this. The hemorrhage, the hospital stay, everything. Those will all get better. Now, how much better, completely back to normal, never deal with a headache or fatigue again, that we don't know. The time's going to take that. But I think certainly kind of this is extremely early in everything, and so I would not be surprised to hear all those things. I think if you were saying you're getting progressively confused and it's just getting worse day by day with headaches, with balance issues, that would be more concerning. But a lot of it is sort of as that blood dissolves on the surface of the brain, it creates inflammation in the lining of the brain, and that creates a sensitivity to light and sounds, intermittent confusion. I don't hear anything that's sort of jumping off the page to say concerning. I definitely think needs to be watched and see, but it is, in 2 weeks better than you are now, and 2 weeks later better than you were, and continue to get better. It's just unfortunately a slow process.
She's definitely better than she was.
Oh,
Okay.
definitely.
Without a
100%.
Okay.
And so, because originally when she was still at Vanderbilt, I was scared to take her home.
Yeah.
I'm not scared to take her home anymore. I feel
Okay,
like she'll
yeah.
be okay.
Okay.
And as long as that, I think that your office and the St. Thomas office is coordinated with her doctor.
Yeah.
And she'll get to see a neurologist there.
Yeah.
And all that jazz. But I'm not scared anymore. I feel like she'll be okay.
Okay. Yeah.
Whereas originally when we were in ICU, I was
Yeah.
like, man, if I try to put her in a car, drive her
Yeah.
home, I'm not sure she'll make it.
And I think that's a lot of it is sort of like day by day, you may not notice the big differences, but when you kind of compare it week by week, notice improvements. And that will usually continue for honestly 3 to 6 months. It may be the incremental improvements over time are a little bit less, but definitely will continue to get better.
Did you see any more blood in the
No,
brain?
actually the blood visually is all gone.
Really?
Really?
That's good news.
Congratulations, Mom.
Thank you, I made it through.
That's probably why you don't have brain attacks anymore.
Yeah.
Exactly. So let me test it for you. Let me see you smile real big. Good. And follow my finger. Okay. Thumbs up in front of you like that. Close your eyes and hold them real still. Alright. Squeeze my hands real tight. Good. Tell me your full name.
Bonnie Road,
What's your date of birth?
12/28/53.
Okay. I have silly questions.
Mhm.
Yeah, so let me show you here. So we'll go back to your very first scan and then your last one. So this was your scan on the 9th, okay? And so this is looking at you as though you're laying on your back and facing the ceiling, okay? So as we scroll up, gray is normal brain tissue. This bright white, that's all bone. And then as we scroll through here, what you'll see this kind of shaggier gray that's kind of all the way through here and around here, that's all blood that is on the surface of the brain that's kind of erupted into and around the brain. Now, one thing is this is not as much blood as some people have, some, very thick, tons and tons of blood, which is why I think when you came in, we're doing as well as you were. But if we look now at the scan, here, you'll see as we get down, all of that kind of shaggier gray is all gone. Now that's artifact from the coils and everything, but as far as all that blood that's out here, you see the black, which is the spinal fluid. That's what we expect. So that all looks good. I don't see any evidence up here of any evidence of a stroke, residual hemorrhage, or swelling or pressure. So overall, I think that looks really good.
I'm very fortunate.
Yes, you are.
And then I'll show you the pictures of the aneurysms. So, let's see here. So if you look at this picture right here, so this is kind of hard to see, but this is your right eye socket, and this is your left, and you're looking out of the screen. And so as we scroll up here, this is your carotid artery. It's taken sort of some loops around here. And then this right here, this is the aneurysm that ruptured, okay? That was the largest, the most irregular, and correlated with the blood the most. And kind of see, actually let's get to the three-dimensional pictures. Kind of see here the orientation of it, sort of arteries coming in, and this whole thing, you see how irregular this is, this sort of daughter lobe and a lobe and a lobe that confers the blood flow going through it is more irregular, which means the risk of rupture is higher. And then during that one, so you'll see here, now this is a catheter with a balloon on it. So that balloon sort of temporarily inflates and holds these coils into place. And these are the coils that are going into the aneurysm. So you see this is normal blood flow here and here out into the vessels, and then this whole thing is what we want to shut down. So basically kind of go into it and then progressively pack more and more coils and fill and fill and fill until we get to the point that now when we take everything out, now we can see, actually that's with the, you can see here, now coils are packed into that aneurysm. There's no flow limit, and all the blood flow around it looks good, but the aneurysm has no filling into it. So that looks good. And then you'll also see over here, this is another aneurysm, okay? And that's the one we treated at the time. So if you'll see here, we went into that, and same thing, put coils into there to block that from getting any blood flow. And that's when we stopped initially, went through kind of everything, and then came back 2 weeks later, or so. And that's when we put in those flow diverting stents to help divert the blood flow away from the residual other aneurysms to make sure those never come back. And so if we look over here, what you'll see is there's actually another aneurysm right here, that little bump right there, and then that right there is another aneurysm, okay?
There's 5 altogether.
Yep. And so then we went in and put this stent here, that's on the right side, and that's actually on the left side, and those basically create a sleeve inside the carotid arteries that over time will shut the blood flow down from getting into those other aneurysms.
Okay.
Okay.
Is she ever going to be able to fly again?
Yeah, so right now there's 0 restrictions as far as physical activities, okay? As far as an activity that's dangerous. If you bend down and pick something up, it may hurt. As far as physical activities though, there's really no restriction. These are non-magnetic, so they don't set off metal detectors. They're MRI compatible. We'll give you a card before you leave today with all the device information, so you have a wallet card. So when you go, like if you need an MRI on your knee, they'll ask you all these questions. But yeah, you are fine to fly, all those kinds of things. What we'd want to do is those blood thinning medicines, so the aspirin and Effiant, but not Effiant, Brilinta,
Yes.
will need to be on for 6 months at least. And so usually, like if you lived here, what we would do is say, okay, goal now is recovery. I'm not worried about big changes, but it's sort of physical activity, therapy, all the things on a day-to-day basis. Know that you will continue to get better. And then in 6 months, we would have you come back and do another angiogram to verify that all the aneurysms are gone and things look good. At that point, if everything looks good, then you could come off of the Brilinta, but you'd be on aspirin as a lifelong medicine. And then periodically we do MRI scans to make sure the aneurysms that we treated never come back, and then that you never develop another one.
How likely?
4% of developing another one.
Right.
Yeah, exactly.
That's
yeah.
not very much.
No, it is low. Now, I mean, the likelihood is you developed one aneurysm, and then a couple of years you developed another, and then another. But usually we get to a point where at the very least we do scans every 5 years, almost like colonoscopies, kind of checking and make sure you don't develop another one.
Oh, I see.
Because
No.
you guys don't have a family history, right?
No.
I mean, you know, yeah.
We have
Wait.
heart disease.
Yeah.
Well, one of the things that concerned us was that the MRI that she had last year, she had it on May 5th of 2024.
The brain MRI.
Yeah, the
Oh, okay.
brain scan showed no aneurysms.
Okay.
And
Okay.
so, and then I was wondering, like, okay, so if we go back to Oklahoma,
So what was the reason for that? I don't think I.
she
yeah.
said she didn't feel
TIAs.
good. She
Okay.
didn't, she said,
TIAs.
She-
Okay. Now, what they may have done, they may have just done a brain MRI scan, which is just looking at the soft tissue. And so that wouldn't necessarily show the aneurysms. You could maybe, if you went back in retrospect, see like the shadow of one, a little cut. But realistically, unless they did a vascular imaging study,
I may not.
yeah, exactly. And so that's not uncommon that those get missed. So I think there are good people there in Oklahoma that at least just looking at, there's, because you guys live close to Oklahoma City, right?
Yeah.
Yes.
Yeah, like the University of Oklahoma, and there's some groups in Oklahoma City that do this work, and I think would be fine to follow it.
Okay.
I mean, if you were going to be back out here, we
No.
could do that. But I
No.
mean, you know, it's
Yeah.
whatever's easy. I think where you are now, I think being able to follow them, as long as they have the right information, the right protocols, which they do,
Right.
then would be fine. I think it's just what they were looking for.
And so now they'll be looking for the right thing.
Mhm, yeah.
Okay, that makes me feel a little better because
Yeah.
I was just like, man, you know.
Yeah, exactly. Yeah. No, it's the kind of thing that like if you go and look at, it's just, unfortunately we'll be able to see, but so like if you're doing a CT scan and you're just looking at like regular, hey, let's just look and see if there's a hemorrhage or a stroke, you're not going to see the arteries. I don't know why this is taking so long to load up.
So if I was gonna have TIAs again, it wouldn't have anything to do with aneurysms.
No, we should not expect that, no. So the likelihood of things changing with the aneurysm is very, very low. And even if you had TIAs, being on the blood thinning medicines is often the treatment, so potentially even lower risk.
Oh, good.
And see, the Brenda is it's the T word.
Ticagrelor, yeah, exactly, yeah.
Yeah, it's the blood thing.
Yeah, because you didn't respond to the Plavix, which is the usual first agent we would use. You just, 1 out of 5 people just don't respond to it for whatever reason. And the
That's
enzyme.
because we're special. Now, I told my GP about my mom,
Mhm.
and he said that I should probably,
Okay,
Get
Get
this.
yeah,
some-
get checked.
so the
He wanted to do a CT with contrast.
CTA, it would have to be an angiogram. So CTA or MRA, so MRI angiogram or CT angiogram. Just CT with contrast is a different thing looking at like soft tissue.
Okay.
Now he may have said we'll do a scan with contrast and may have meant, I assume, a CT angiogram, but that would just make sure that's the component.
Okay.
That's one of the things we wanted to know is like what are the right tests? And
Yeah,
so that
exactly.
because she didn't get the right test. She
Yeah.
wasn't feeling good. She was
Yeah.
having issues.
And we'll spell out so that If you have, what are the physicians' names? What's your primary care physician's name?
Dr. Seek, Sieck.
Okay. In Norman, Oklahoma? or-
Norman, Oklahoma.
And I granted him access to the Vanderbilt.
Okay, yeah,
And so he's on that app.
okay. So we will, so one, the letters will go automatically to him, as well as my assistant will send a written letter. But basically just outline every step, what we would do, when, and the people there they may do a scan at a different time interval, that's okay, but just sort of knowing which ones are,
That's perfect.
Yeah.
We really appreciate you. Thank you so much.
I know it's a bad, tough situation, you're here visiting and all this, but hopefully get everything treated, and now you can kind of go home. It's recovery. Every once in a while, check in to get followed up and go from there.
I think-
It's Christian Seek. if you
Kristen, okay,
So I know that home health and rehab and all are coming to her house, so that's really good.
okay,
So she'll be able to get it. She's doing a lot better. She's really advancing well. That's why she's got a rollator instead of a walker.
Yeah.
So
yeah. I think it'll take a little time to get everything, but get you back to being independent and all those things. May get fatigued a little bit more. Maybe your short-term memory is not perfectly crisp, but at the same time, get back to normal life.
That's great news. Great
Do you
news.
think that she's capable of being by herself in her house?
I think I would say give it the first week and see how things go, and just see when you're at home as far
You
as
just
activities.
busted that bubble. So.
I mean, I think realistically, yes, but I think the main thing is going to be like, hey, if you get up in the middle of the night and you're sort of trying to get acclimated, forget where you are or something, and then, or just getting shower and all that. But I mean, at least a couple of days of just, hey, let's just watch and be close and be careful, I think would be reasonable. And then use common sense and say, hey, yeah, you're doing fine, and then we check on you and things like that.
Okay, that's wonderful.
yeah,
Can you compromise and do that?
it'll be good. It'll be good. We get to go home.
Okay.
Yeah.
So we have the all clear to take her home?
Yeah, absolutely. Yeah. So hang on here for a couple seconds. Let me just make sure we got everything set up, and then the wallet cards with all the information, so that there's no questions, and then we go from there.
Thank you so much.
Okay.
Thank
Yeah.
you so much.
Good seeing you. Yeah, absolutely.
And thanks for doing such a good job.
No, I appreciate it. Yeah, absolutely. I know this is not a situation you want to be in, but hopefully we don't add problems to it. So,
Thank you.
yeah,
I think it was a
absolutely.
blessing we were here.
Yeah, well, I appreciate it. Yeah, it was nice to meet you.
Thank you.
Yeah,
Thank you.
absolutely. So yeah, y'all take care, and then we'll get you guys going in just a little bit.
Okay, great. Thank you.
Yeah. Are you guys driving back?
Yes, we are.
How long
Yes.
is the drive?
We've got car
About
loaded
12
in
hours, but
and
we're going to
Okay.
stop halfway.
It's not. I mean, it's not terrible. I would
We're on
have
our
thought it was
way up
longer. Yeah.
right now.
Okay.
Thank you.
Y'all take
Thank
care.
you.